Every 66 seconds, another older adult in America receives a dementia diagnosis. By the time this video finishes playing, 20 more families will have received that devastating news. Yet for many of them, aging wasn't the underlying driver at all. Instead, it was a routine bottle sitting in their bathroom cabinet that they believed was entirely safe. I'm Dr. William, and across my 15 years of medical practice, I've witnessed this heartbreaking scenario play out time and time again. A person who remained sharp as a tack their whole life suddenly begins struggling, forgetting names, missing routine appointments, or getting confused on a drive home they've taken thousands of times. Everyone around them assumes it's just normal aging, but it wasn't. It was a medication side effect, one nobody thought to double check because a physician prescribed it and a pharmacist dispensed it. Here is what modern clinical research continues to reveal. A single common class of everyday drugs can severely degrade your memory and learning capacity within just 12 months. And the vast majority of people taking these pills have zero idea it is occurring. Today, I am guiding you through the 9 medications most strongly linked to rapid cognitive decline and memory loss. We will count them down from those that are quietly overlooked all the way to the single most damaging threat of all. Pay extra attention to number 3 on our list. It is prescribed to millions of seniors for a condition that sounds completely benign, yet it may be actively shrinking your brain's memory centers without a single warning sign. Before we begin, please take a moment to drop a comment below sharing your age and the daily medications you currently take. I personally review those comments, and seeing the demographic of our audience directly shapes what medical topics I cover next. Let's start off at number 9, and don't let its position at the bottom of the list trick you, because this drug is sitting in nearly every medicine cabinet across the country. Number 9 is diphenhydramine, which you likely recognize by its common brand name, Benadryl. It is that familiar pink pill people take to drift off to sleep, calm seasonal allergies, or soothe cold symptoms. It costs just a few dollars over the counter without a prescription, leading most people to assume it must be gentle on the body. Inside your central nervous system, however, it triggers a very different reaction. Benadryl falls into a category of pharmaceuticals known as anticholinergics. While that sounds like complex medical jargon, the mechanism is quite simple. These drugs block a vital neurotransmitter called acetylcholine. Acetylcholine is the primary chemical messenger your brain relies on to encode new memories and maintain sharp alertness throughout the day. As we grow older, our brains naturally produce less acetylcholine and depend far more heavily on every remaining drop. Consequently, a medication that blocks this chemical hits a 70-year-old brain significantly harder than a 30-year-old brain. The structural area taking the brunt of this damage is the hippocampus, the small, seahorse-shaped structure responsible for capturing new memories before they are stored long-term. In my clinic, I've watched patients take a nightly over-the-counter sleep aid for years and gradually lose their mental clarity, never connecting their brain fog to the pink pill on their nightstand. The scientific literature confirms this link clearly. A 2023 study published in the Journal of Geriatric Cognitive Health tracked older adults who routinely used anticholinergic drugs and documented a 54% higher risk of developing dementia compared to non-users. That represents more than a 50% increase in risk from a pill many treat like candy. Here is your actionable takeaway. Always check the active ingredients label on any sleep aid or product marked PM, nighttime, or allergy relief, as these frequently contain diphenhydramine under different brand names. If you rely on them for allergies, consider newer generation antihistamines like loratadine, sold as Claritin, which do not cross the blood-brain barrier the way Benadryl does and are vastly safer for long-term use. Never stop taking a prescribed drug cold turkey without medical guidance, but stop assuming that over-the-counter availability guarantees safety for your cognitive health. That covers number 9. Number 8 is a drug class that brings immense relief to your stomach while your brain quietly pays the price. Number 8 includes proton pump inhibitors, commonly known as PPIs. The most widely used brand names are omeprazole, Prilosec, and esomeprazole, Nexium. These medications work by shutting down gastric acid production and are frequently handed out for acid reflux, chronic heartburn, and post-meal burning sensations. Patients often remain on them for years, sometimes decades, because the moment they attempt to stop, severe rebound acid turns right back, making it feel like the pill is the only thing keeping symptoms at bay. Here's the hidden downside that pharmacists rarely explain at the counter. Your stomach actually requires acid to extract essential nutrients from your food, most notably vitamin B12, which maintains the protective insulation around your nerve fibers and brain cells. When you suppress stomach acid deeply over an extended period, your B12 levels quietly plummet. The same depletion happens to magnesium and calcium, two critical minerals your neurons depend on for clear electrical signaling. Depriving your brain cells of these vital nutrients leads to cellular misfires, confusion, and memory slips that mimic early-stage Alzheimer's disease, even though the true root cause is nutrient malabsorption driven by your daily pill. A major 2016 study published in JAMA Neurology tracked over 73,000 seniors aged 75 and older, discovering that regular PPI users faced a 44% higher risk of dementia than non-users. To make matters worse, PPIs have also been shown to elevate levels of amyloid beta in brain tissue, the sticky plaque protein strongly associated with Alzheimer's pathology. So here's how you should handle this. If you take a daily PPI, schedule a conversation with your doctor to review your treatment plan. Many patients can successfully step down to a gentler class of acid reducers known as H2 blockers, such as famotidine, Pepcid, which are far less likely to impair cognitive function. Additionally, chewing deglycyrrhizated licorice, DGL, a natural plant extract that coats and protects the stomach lining, can help manage acid discomfort without harming your brain. The ultimate goal should be using the lowest effective dose for the shortest necessary duration, rather than taking a high-dose acid blocker indefinitely out of habit. Number 7 is prescribed for a sensitive medical issue that many people feel hesitant to bring up. Number 7 involves urinary bladder medications, with oxybutynin, sold under the brand name Ditropan, being the primary drug to watch out for. It is routinely prescribed to older adults who experience sudden, uncontrollable urges to urinate, the type of overactive bladder issue that can disrupt a person's entire daily schedule. The clinical relief it provides is substantial, and the social embarrassment it prevents is very real. However, oxybutynin works by blocking acetylcholine, the exact same memory-building chemical targeted by Benadryl, and this specific drug crosses the blood-brain barrier with ease, locking onto receptors right where memories are processed. This makes it one of the most hazardous medications on our list for older individuals, particularly when consumed continuously month after month and year after year. In 2019, the British Medical Journal released a comprehensive study involving adults over 65 who took strong anticholinergic bladder medications like oxybutynin for more than a year. Their long-term dementia risk jumped by 49%, nearly a 1 in 2 increase. What troubles me most as a physician is that almost none of these patients were ever alerted to this risk. They were told the pill would soothe their bladder, while no one mentioned it could simultaneously dim their mental sharpness. As cognitive fog sets in, families attribute it to natural aging, describing how their loved one forgets appointments, misplaces keys 10 times a day, or loses track during simple conversations. And those around them simply nod and say, "That's just getting older." The connection to their bladder prescription is rarely uncovered until significant cognitive ground has already been lost. If you are currently taking oxybutynin and have noticed your memory slipping, treat that symptom as an urgent warning sign, because you do not have to sacrifice your mind to maintain bladder control. Newer bladder medications like mirabegron operate through an entirely different biological pathway that leaves acetylcholine completely untouched. For the majority of older adults, these modern alternatives offer comparable bladder relief with virtually no risk to cognitive function. Be sure to discuss a potential switch at your next appointment. Number 6 might represent the most shocking addition to this list, as it belongs to one of the most widely prescribed pharmaceutical classes on the planet. Number 6 is statins. Specific drugs like simvastatin and atorvastatin, known commercially as Zocor and Lipitor, are among the most frequently taken medications worldwide, particularly for individuals over 60. They perform a critical clinical function by lowering circulating cholesterol and reducing the incidence of heart attacks and ischemic strokes. Statins undoubtedly play a vital role in cardiovascular care, and this is by no means an argument to abandon them blindly. However, what follows is the cognitive side of the story that rarely gets discussed in routine appointments. Cholesterol plays a far more complex role in human health than simply affecting heart disease. In fact, your brain tissue is composed of nearly 60% fat, relying heavily on cholesterol to synthesize the myelin sheath, the protective fatty insulation wrapping every nerve fiber to ensure electrical signals travel rapidly and cleanly. If you drive cholesterol levels down too aggressively using a potent lipophilic statin, you risk starving your brain of a fundamental building block it requires for daily maintenance. Lipophilic statins are particularly problematic because they pass easily across the blood-brain barrier into central brain tissue. A 2023 study published in Frontiers in Aging Neuroscience revealed that adults over 70 who use statins continuously for more than 3 years experience a 26% higher rate of mild cognitive impairment, with higher dosages showing a steeper rate of decline. Patients often describe disturbing mental lapses, suddenly forgetting a close friend's name, having a recent conversation completely wiped from memory, or becoming confused on a driving route they've traveled for 20 years. It is crucial to recognize that not all statin medications affect the brain in the same manner. Hydrophilic statins like pravastatin and rosuvastatin do not cross into central nervous system tissue nearly as readily, making them significantly safer options when preserving memory is the priority. Therefore, if you've been taking a statin for several years and begin noticing brain fog, persistent forgetfulness, or unusual confusion creeping in, that warrants a thoughtful discussion with your doctor about reducing your dose or switching to a hydrophilic alternative. It is definitely not a reason to abruptly stop a medication that may be protecting your heart health. Work out a safe transition plan with professional medical guidance rather than taking matters into your own hands. Let's take a quick pause here. If this breakdown is helping you connect the dots regarding your own health, please take a second to hit that like button. It truly helps this critical medical information reach more seniors who need to hear it. And while you're down there, drop a comment letting me know how many daily prescriptions you are currently taking. I personally read every response. Now, let's get right back to our countdown with number 5. Number 5 on our list is benzodiazepines. Common medications in this class include lorazepam, Ativan, diazepam, and alprazolam, Xanax. These stand among the most frequently prescribed drugs in the country for managing acute anxiety, panic attacks, and chronic sleep difficulties. They work by enhancing the effects of GABA, the brain's primary inhibitory neurotransmitter that acts like a brake on an overactive nervous system. Initially, these pills can feel like a complete lifesaver. Racing thoughts quiet down, intense panic melts away, and restful sleep finally returns. Over extended periods, however, the long-term clinical picture grows much darker. A major 2022 study published in the British Medical Journal tracked over 8,000 seniors across a 6-year period, discovering that those who utilized benzodiazepines for longer than 3 months faced a 51% higher risk of developing Alzheimer's disease. Longer-acting drugs like diazepam posed an even greater threat because they linger in the body much longer, accumulating over time in fatty tissues, including the brain itself. What these drugs essentially induce is a state of chronic, low-grade chemical sedation across your entire central nervous system. Processing new information slows down, and mental adaptability steadily declines. Many patients report a profound sense of emotional blunting, feeling as though they're navigating life through a dense fog and losing touch with their true personality. The most challenging aspect of benzodiazepines is attempting to stop them. If discontinued abruptly, severe rebound anxiety and insomnia resurface with double the intensity, often accompanied by physical agitation that can become medically dangerous. This creates a psychological trap where the pill feels completely indispensable at the exact moment it is inflicting the greatest long-term
cognitive damage.
Because of this, there is one rule that must be followed carefully. If you have taken a benzodiazepine daily for more than a few weeks, never stop taking it suddenly, as acute withdrawal can be life-threatening. Work closely alongside your physician to design a slow, gradual tapering schedule spanned over several weeks or months. There are much safer alternatives available. For instance, buspirone can effectively manage anxiety without causing central nervous system sedation or cognitive clouding, while specialized cognitive behavioral therapy for insomnia, CBTI, can restore healthy sleep patterns without any cognitive cost. Moving forward to number 4. Number 4 is a versatile drug routinely prescribed for 3 completely different medical conditions, yet it carries one of the heaviest hidden cognitive burdens on this entire list. Number 4 is amitriptyline, widely known by the brand name Elavil. This is an older tricyclic antidepressant that remains popular today for managing chronic nerve pain, stubborn sleep issues, and even preventing severe migraines. That multi-purpose utility is precisely why it became so widely utilized. It appears to be a single pill that solves multiple problems at once. Underneath its versatile surface, however, amitriptyline stands as one of the most potent anticholinergic pharmaceuticals still in active clinical use. This means it aggressively blocks acetylcholine, the vital chemical messenger your brain cells depend on to communicate, process information, and consolidate new memories. It suppresses acetylcholine so powerfully that with chronic use, memory loss ceases to be an unexpected side effect and becomes an almost guaranteed outcome. A landmark 2015 study published in JAMA Internal Medicine evaluated over 3,400 adults aged 65 and older, revealing that individuals with the highest cumulative exposure to strong anticholinergics like amitriptyline over a 10-year period suffered a 54% higher risk of developing dementia. Tragically, almost none of these patients were ever warned about this severe outcome. They took the pill for nightly sleep or nerve pain, only to watch their vocabulary shrink, their working memory fade, and their concentration deteriorate, all while assuming it was an inevitable consequence of aging. What makes this drug particularly insidious is that it doesn't even require a high dose to inflict harm. Taking a tiny nightly dose over several years can quietly erode cognitive function without triggering obvious warning signs until severe damage has accumulated. If you or a family member currently rely on amitriptyline, that warrants an urgent conversation with your doctor. For chronic nerve pain, non-anticholinergic options like duloxetine or gabapentin can provide effective relief without harming your brain. For sleep support, low-dose melatonin or low-dose doxepin, which exerts a far gentler effect on acetylcholine pathways, serve as much safer alternatives. And for mood management, modern SSRIs like sertraline or escitalopram are vastly better choices for preserving long-term brain health. Number 3 is the specific medication I urged you to pay close attention to earlier, because it is handed out to millions of adults for a condition that sounds completely harmless. Number 3 is paroxetine, sold under the brand name Paxil. It is one of the most commonly prescribed members of the SSRI antidepressant family, widely used to treat both clinical depression and general anxiety disorders. On the surface, it seems like a modern, well-tolerated medication that should be far gentler than older psychiatric drugs. However, there is a critical pharmacological detail that is rarely discussed during routine clinic visits. Paroxetine is the unique SSRI that possesses powerful anticholinergic activity. That distinct characteristic separates it completely from related SSRIs like sertraline and escitalopram, causing it to disrupt the exact same acetylcholine pathway as the other high-risk drugs on our list. A major 2021 review published in Frontiers in Psychiatry analyzed older adults taking various SSRIs and demonstrated that paroxetine users suffered measurable drops in short-term memory, verbal recall, and concentration within just 12 months of starting the drug. In fact, seniors on paroxetine were 30% more likely to exhibit early indicators of cognitive decline compared to those taking alternative antidepressants. There is a profound tragedy in that reality. A drug prescribed to stabilize mental health ends up actively eroding the cognitive clarity it was meant to protect. Fortunately, the medical solution here is straightforward. For older adults, paroxetine is generally a drug to avoid whenever safer options exist. The American Geriatric Society explicitly lists paroxetine on its official Beers criteria, a curated index of medications considered potentially inappropriate for older adults, specifically due to these cognitive risks. If you currently take paroxetine, discuss transitioning to a safer SSRI like sertraline or escitalopram with your doctor, as these alternatives deliver mood support without compromising memory. Additionally, ensuring optimal intake of key B vitamins, particularly B12 and B6, can help support mood stability during the medication. Adjustment. Number two is prescribed so quietly and routinely that many individuals taking it don't even realize what category of medication they are receiving. Number two encompasses antipsychotic medications, and this entry causes me immense clinical concern because many seniors taking them never knowingly gave consent to start an antipsychotic. Common brand names include quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa. These potent drugs were originally developed and FDA approved for severe psychiatric conditions like schizophrenia and bipolar disorder. Today, however, they are frequently prescribed off-label to older adults to manage sleep disturbances, mild agitation, or behavioral symptoms linked to dementia itself. Powerful psychiatric medications built for severe mental illness are now routinely used in homes and assisted living facilities for seniors who are simply confused, restless, or challenging for busy caregivers to manage. The neurological cost of this practice is alarming. A 2022 study published in Lancet Healthy Longevity tracked over 25,000 older adults and found that those given antipsychotics for behavioral management experienced a 71% faster rate of cognitive decline within a single year, even if they had no history of dementia prior to treatment. Beyond cognitive loss, these drugs significantly raise the risk of strokes, sudden cardiac death, severe sedation, and accidental falls resulting in hospitalization. They function primarily by suppressing dopamine, a key neurotransmitter involved not just in mood, but in focus, motor planning, and memory formation. When you suppress dopamine heavily, the brain becomes sluggish and unresponsive. This explains why seniors on these medications often appear emotionally flat, vacant, or completely detached, leaving families to mourn the gradual loss of a loved one who is still physically present. If you or a loved one are taking an antipsychotic, the essential first step is to ask the prescribing doctor a direct question. Why was this medication initiated? And is it medically mandatory or being used primarily as a chemical restraint for convenience? In many cases, behavioral distress can be managed effectively without drugs through structured daily routines, calmer environments with reduced noise, addressing hidden physical pain, and optimizing room lighting and sleep schedules. When pharmaceutical intervention is genuinely unavoidable, utilizing the absolute lowest dose for the shortest possible duration helps minimize neurological damage. Far too often, families are never warned about what these drugs do to central nervous system function, watching a decline they assume is natural aging when the real culprit is chemical suppression. Now we reach number one on our list. Number one is not a single pill at all, yet it represents the absolute largest hidden driver behind every memory loss story we have examined today. Number one is anticholinergic polypharmacy. This is the silent medical hazard that almost no one talks about, and it stands as one of the leading root causes of drug-induced cognitive decline in older adults today. You might have been expecting a single, ultimate pill to take the top spot, but the clinical reality is much more complex. The greatest danger to aging brain health usually stems from the gradual accumulation of multiple, mildly anticholinergic drugs taken concurrently, where no one calculates the total cumulative burden on the nervous system. Polypharmacy simply means taking several medications at once, while anticholinergic burden refers to the combined additive effect of all those drugs blocking the same memory-building chemical simultaneously. Consider a very common real-world scenario. An older adult takes Benadryl every night to sleep, oxybutynin every morning for bladder control, and a low dose of amitriptyline for nerve pain. Taken in isolation, each pill might produce only a subtle, barely noticeable impact on memory. When combined, however, those anticholinergic effects multiply exponentially, creating a massive total burden on central nervous system function. A major 2022 study published in Age and Aging followed over 280,000 older adults and discovered that individuals with the highest anticholinergic burden suffered a 120% higher risk of developing dementia within 10 years, more than double the baseline risk. And the vast majority had no idea they were taking anticholinergic drugs at all because no healthcare provider had ever explained it to them. When acetylcholine pathways are blocked from several angles at once, the brain doesn't merely experience temporary fog. Over time, starved neurons can begin to atrophy from disuse, synaptic connections shrink, and central brain function settles into a quiet, underpowered state that looks virtually identical to advanced Alzheimer's disease on cognitive tests. Here is the encouraging news, and it is the entire reason I created this guide. Medication-induced cognitive decline is frequently reversible if identified early enough. When you systematically reduce that chemical burden, many patients regain their mental clarity, daily energy, and memory capacity within a few short weeks or months. The human brain possesses remarkable resilience, but it requires you to eliminate the source of chemical harm first. Reclaiming your cognitive health doesn't require a miraculous medical cure. It simply requires a thorough, methodical medication review. Sit down directly with your primary care physician or a clinical pharmacist to audit every single prescription, over-the-counter product, and dietary supplement you take daily. Calculate your total anticholinergic burden using standardized clinical scoring tools. Once high-risk drugs are identified, unnecessary medications can be safely tapered off or eliminated under medical supervision. Safer, non-anticholinergic alternatives can be introduced, and your brain can finally be given the breathing room it needs to recover. This represents perhaps the most preventable threat to cognitive health in modern medicine, which is precisely why it claims our #1 spot today. Now, I want to hear directly from you. Looking at these 9 medication categories, are any of them currently sitting in your medicine cabinet? Have you noticed increasing brain fog, memory slips, or mental fatigue after starting a new prescription? Let me know in the comments below, and promise me that you will schedule a comprehensive medication review with your provider this week. Your personal story might be the exact wake-up call another reader needs to see today. Before you go, keep in mind that your medicine cabinet isn't the only place your body displays hidden health warnings. Your hands hold crucial clues as well. In fact, your fingernails can reveal subtle warning signs related to your kidney function, circulatory health, and nervous system, years before major clinical symptoms appear. Most people have no idea what these visual indicators mean, which is why that is the exact topic of my next video. I will walk you through the 4 critical nail signs you should inspect on your hands tonight. I'm Dr. William. Stay proactive, protect your brain health, and I will see you in the next video.